Morning, everyone. Great to see you all. Thanks for being here, especially those who have traveled. There are a lot of familiar faces. There's a lot of new faces, especially, again, I still call it this post-COVID world, where some of the faces I recognize are from Zoom, not in person. So very happy that you're all here so I can be able to actually see you in person. So thank you. On behalf of the Better Medicare Alliance, our board of directors, several of whom are here, our allies, and our senior grassroots network, which I'm also happy to say we have several of those seniors here, I want to welcome you to the 2025 Medicare Advantage Leadership and Policy Forum. Thank you. This forum is something that I look forward to every year. It's a chance for us to step back, take a pause, and bring together leaders like all of you who are serving seniors in the Medicare Advantage community across healthcare policy and being able to have the candid, forward-looking conversations that we need to have on the current state of Medicare Advantage and the future of Medicare Advantage. It's really important to focus on what is affecting the beneficiaries who we're serving. Medicare Advantage, on average, is spending nearly over $3,500 less each year compared to fee-for-service. And 95% of those seniors are satisfied with their care. And again, as I talk with those who are, as we kick off open enrollment today, seniors are choosing Medicare Advantage during that open enrollment period. And these aren't just numbers. This is peace of mind for those seniors who are living on fixed incomes. At the same time, we can't ignore the headwinds that are facing Medicare Advantage. Rising medical costs, ongoing policy uncertainty, enforcing tough trade-offs, such as, such as plan exits and closures, higher out-of-pocket costs, and reduced supplemental benefits for many seniors who maybe had those benefits a few years ago and no longer do. And we hear from seniors every day. They're worried, especially right now. There's too many choices between filling a prescription or paying electric bills, between groceries and gas to paying for travel to see their grandchildren. They're facing plan closures or losing essential health benefits that they rely on. Now, more than ever, we need our policymakers in the executive and legislative branch, many of whom are joining us today, to protect the care that these seniors depend on. And it's not just seniors who are seeing what's at stake. It's also voters. 84% of those seniors want to maintain the current funding for Medicare Advantage. 2/3 oppose the No Upcode Act, a piece of legislation that is currently before Congress that would constitute a significant cut to Medicare Advantage voters. And they recognize that need to recognize that is a cut to Medicare Advantage is a cut to Medicare. And we have seniors with us today who have been on the Hill speaking to this concern. These are seniors who overwhelmingly see the value of the program and support the program. And we want to be a part of protecting it, but also seeing where there's policy solutions that we can be addressing that continue to strengthen the program. And that's why today's conversation matters, and we'll be convening with our allies and talking with policymakers about a lot of those policy solutions that we need to address to support the program. Today, we're going to be beginning with my friend Dr. Mark Fendrick from the University of Michigan, who's with us, exploring how Medicare Advantage continues to advance value-based care. Mark will be speaking with several of our allies, bringing physicians and innovators together who see firsthand what coordinated care means. We'll also hear from Congressman Aaron Bean of Florida, who serves on the Ways and Means Committee, who is advancing efforts to give seniors clearer comparisons of traditional fee-for-service Medicare to Medicare Advantage. We'll also be joined by CMS Administrator Dr. Oz, who's so gracious for giving us his time today and has been a real leader on looking at the Medicare program and who sees the value of Medicare Advantage, and he'll share his vision on the future of the program. We'll also hear from a former CMS administrator and health policy advisor to President Obama, Nancy Ann DeParle, one of those respected voices in healthcare policy. Today, or tomorrow, we're going to be releasing the 2025 Medicare Advantage report, the State of MA, and you'll be hearing insights on that report with a preview today in our partnership with ATI Advisory. We're also going to be joined by another congressman, Representative Nick Langworthy, serving on the House Energy and Commerce Committee. And I'll be having a fireside chat with one of the nation's most recognized thought leaders in healthcare and economic policy, Doug Holtz-Eakin, the president of the American Action Forum. And then, of course, throughout the day, most importantly, we're going to be hearing from those of you in the room, our allies and beneficiaries, on the value of MA and the concerns where we need to address the program to meet seniors' needs. As we look ahead, Better Medicare Alliance, with our allies, needs to focus on looking at data and research to strengthen the program. And as much as we're here to protect the program, we want to also see where we need to improve it. And so in closing, I just wanted to recognize some of the reform priority areas that we'll focus on. And sorry if it comes across I'm rushing, but I'm so excited to be able to hear from all of you and not myself. So if you see me rushing through, that's why. But it's really important to focus on those reform priorities before we close. One area that is a thread through all of our priority work is preserving payment stability. Focusing on coordinated value-based care, again, one of the panels that we'll focus on today. Also, we're focusing on modernizing in-home health assessments, another panel that we'll have today, where we really need to be making improvements to enhance follow-up care and oversight. Also, an area where BMA has led in supporting is streamlining and digitalizing prior authorization to improve timely access to care, an area I'll talk about with Dr. Oz. And we can't lose sight of where we need accountability from the plans who are serving our seniors and in our partnership with CMS to be in line with the oversight and the guidance that they put out. We need to ensure that program integrity is throughout the program is accurate and it's accountable. So in closing, I want to thank all of you for being here, especially in light of our Medicare enrollment period kicking off today, an important time where seniors are going to be making their choices, and for us using our dialogue today to keep the seniors at the front and center of our conversations. Thank you to all of you. Thank you to our board. Thank you to your allies, and also a special thank you to the BMA team for making today possible. Look forward to hearing from all of you today, and also really look forward to having time with you one-on-one. Thank you.